Hi guys, it's been a long since I haven't uploaded any video, but I finally decided to upload one video from anatomy, and that's going to be the sciatic nerve from the lower limb. Sciatic nerve is a very important nerve to be considered in the lower limb, and it supplies the posterior compartment of the thigh, and it's a very important nerve. And what is more important than that is that the sciatic nerve course, it supplies to multiple muscles, its origin and the insertion, everything is so important. But before beginning, I would like to say something different, something more interesting. That is, guys, few days back I had went to Vatunga, and over there I saw one book, that is A Silent Patient. I have been seeing this book being read by my seniors and my friends and discussing about the beauty of the book a lot of times, but in person I have never read it. But I finally read it, and I realized that the book is so beautiful. The story is so intricately delicate, and it's so intertwined with the normal human behavior. It is related somewhere to the medical profession, to the depression and psychoactive disorders and this and that. But despite of that, the crux of the story lies in the emotional basis and the unhealthy, or we can say intertwined and intrinsically complicated and super exaggerated relationships which mankind holds in between them. So it's a very nice book. To be honest, I'll tell the entire crux of the book at the end of this video, but it was the brief intro. So without wasting time, first let's start about the sciatic nerve and complete it fast so that we can discuss about the silent patient. So the important thing is that the sciatic nerve root value is basically L4, L5, S1, S2 and S3. These are the root values of the sciatic nerve, and the sciatic nerve basically emerges from the greater sciatic notch below the piriformis muscle. That is very important. Very important thing to understand is there are a lot of structures which get out from the greater sciatic notch. Those are the basically superior gluteal vessels, inferior gluteal vessels. Then we have also other vessels and nerves involved, and also the sciatic nerve which gets from the greater sciatic notch also. So in the thigh, it does not provide any innervation to the gluteal region, but in the thigh, this what happens exactly is that the sciatic nerve has two components. It has a common peroneal component, we can draw it like this. It's a common peroneal component, and it has one more component which is called as a tibial component. So that is a tibial component. So common peroneal and tibial components, and sciatic nerve is a combination of these two. So talking about common peroneal component, this common peroneal component is basically formed by the dorsal division of the ventral primary rami of L4 to S3. L4 to S3, as we discussed root value. So dorsal division and ventral division. So these are two divisions of a ventral primary rami of the L4 to S3. From there arises this common peroneal component, and this common peroneal component supplies the short head of the biceps femoris, and this short head of biceps femoris belongs to basically the hamstrings muscle. Then next what we have is the tibial component. In tibial component, basically the ventral division of the ventral primary rami L4 to S3, and this ventral component basically supplies semitendinosus. We have its one branch to semitendinosus. Then we have one more branch to semimembranosus. Then we have its branch to basically adductor magnus, hamstring. We can say it's a hamstring part, and long head of biceps femoris being the other one. Long head of biceps femoris. So origin of long head of biceps femoris is from the ischial tuberosity. Very important thing. Next is other muscles which have origin from ischial tuberosity are also adductor magnus, semitendinosus and semimembranosus. So in the popliteal fossa, how the course goes. So it's very important that the sciatic nerve Now what happens is the common peroneal nerve, it has went over there and it supplied a short head of the that thing. So we can say, for example, that's the popliteal fossa, and here we can say that this is the sciatic nerve, and from the sciatic nerve goes the common peroneal nerve. And here the common peroneal has basically what happened, common peroneal supplied a short head of bicep brachii. Then what happened, this is the neck of fibula. Over the neck of fibula it rotates, very important. This is the course of common peroneal nerve, please understand. It has now detached from the sciatic nerve as a wholesome, and now what happened is that it at the neck of the fibula, you can see it has rotated around the neck of the fibula, and once it rotates it gets divided into two parts. One is the basically superficial peroneal nerve, as you can see, that's the superficial peroneal nerve, and other part it has divided is known as a deep peroneal nerve. So superficial peroneal and deep peroneal nerve. This superficial peroneal nerve is supplying the lateral compartment of the leg, and deep peroneal nerve is supplying the anterior compartment of the leg. So deep peroneal, which supplies basically the anterior compartment of the leg, and this is superficial peroneal, which compartment is lateral compartment of the leg. Next what we have is this nerve which is known as a popliteal fossa, and this nerve which is known as a tibial nerve. Now what is this tibial nerve? Common peroneal nerve we discussed, super lateral compartment and the anterior compartment respectively, that's what we call as a tibial nerve. Now this tibial nerve is supplied the posterior compartment, so all the three compartments are now sorted. Next what we talk about is the branches of it. Now we will branches talk about in this only, like see, first is the thing is ki this is a popliteal fossa. Over here this is the sciatic nerve, common peroneal branch and tibial branch. So this is the tibial branch. From the tibial branch, the first branch goes to the muscle which is known as a gastrocnemius muscle. Second branch goes to basically the plantaris muscle. Okay, so basically gastrocnemius muscle and plantaris muscle. Then one branch which goes is known as basically the popliteus muscle. This popliteus muscle is actually the muscle belonging to the posterior compartment of the leg. Then what happens is the one more branch which is called as a genicular branches. This genicular branch of the sciatic nerve, the genicular branch of sciatic nerve is given to basically knee joint, to a complete knee joint. We will study it afterwards. So knee joint, what it is the genicular branch of the tibial nerve. Then along the basically posterior compartment of the leg, so what are the muscles of posterior compartment of the leg? We have basically soleus, correct. Soleus के बाद में what we have the superficial muscles. Let's first discuss. We have basically soleus, then we have superficial muscles में on the posterior compartment we had popliteus, soleus, and we had one more muscle on the superficial compartment which was basically plantaris, we can say. Yes, popliteus is a deep muscle, sorry, not a superficial muscle. Soleus, plantaris, these two muscles are there. Okay, in the superficial component of the posterior compartment of the leg. Then we also have few more muscles as flexor hallucis longus, we can say in deep muscle, flexor digitorum longus and tibialis posterior. So flexor digitorum longus, then we have basically tibialis posterior. So these are the muscles. Can we once again revise? Gastrocnemius muscle, plantaris, popliteus, then genicular branch of the to the knee joint, then soleus, tibialis posterior, then we have basically flexor digitorum longus and flexor hallucis longus. So these are the muscles. Okay, tell me, if flexor digitorum longus is in the leg, flexor digitorum brevis will be in the, of course, in the sole, correct, and flexor hallucis brevis will also be in the sole, and both flexor digitorum brevis, flexor hallucis brevis and adductor brevis, these three muscles are basically present over where? These are present as the muscles of the sole. In which layer? In the third layer of muscles of the sole. So this is important info to understand. And next, as you discuss, flexor retinaculum will be present, and from here the flexor retinaculum, which nerve passes is important, to the posterior tibial artery, and sciatic nerve passes, correct. So sciatic nerve say versus the flexor retinaculum, calcaneum and medial malleolus. So this is very important. Okay, then after passing through flexor retinaculum, it will give two branches, medial plantar branch and lateral plantar branch. So this is the medial plantar branch and this is the lateral plantar branch. Now we will discuss about the branches over here. So these were the branches, common peroneal nerve and this tibial nerve branches. Now after that we will discuss about the branches of common peroneal nerve. But before that, first let's discuss की medial plantar branch or lateral plantar branch दिल्यानंतर what muscles, कोणकोणते muscles it supplies. So first layer of psoas muscle. What are those? Medial plantar abductor hallucis, flexor digitorum brevis, correct? These two. And lateral plantar nerve will be from first will be abductor digiti minimi. So basically abductor hallucis, we can say abductor hallucis and flexor digitorum brevis. Then second layer मध्ये we what we have lumbricals, right? First lumbrical, flexor digitorum accessorius, very important, and second, third and fourth lumbricals it will be supplied by the lateral one. Then what we have here next is a third layer, flexor hallucis brevis. Then we have basically adductor hallucis and flexor digiti minimi brevis. In the fourth layer only we have all introsci, both three dorsal and four plantar three plantar and four dorsal introsci. All of them will be supplied by the lateral plantar branch of the tibial part of sciatic nerve. Now we will discuss about a very important nerve which is known as a common peroneal nerve. What we saw in common peroneal nerve, that from here, from this popliteal fossa, it moved out. Then this was the neck of fibula, right? This was the neck of fibula. Now around the neck of fibula it rotated like this, and it rotated, it gave a superficial branch and it gave basically a deep branch. Deep branch, anterior superficial branch was giving to the lateral compartment, right? So what we'll discuss, what we'll have, so lateral compartment only superficial branch this is, and lateral compartment only two muscles we know. What are those? Peroneus longus and peroneus brevis. So two branches to both of them. And over here in the posterior compartment we have basically extensor hallucis longus. Then we have extensor digitorum longus. Then we have basically tibialis anterior, okay, extensor. And then what we have is basically flexor tibialis anterior, then extensor retinaculum. Can you see this extensor retinaculum over here? Like this it is na, extensor retinaculum like this, and then it has two heads and one stem. And this, which is basically lower part of the anterior part of tibia, lower part of the anterior surface of the fibula, attachment of the extensor retinaculum, and the structures which nerve passes is the common peroneal nerve ka branch. Okay, so extensor digitorum reticulum, extensor digitorum brevis. Okay, it supplies to extensor digitorum brevis, extensor digitorum brevis and flexor digitorum brevis. Extensor digitorum brevis only most is seen in the dorsum of the foot. Okay, that's the common peroneal nerve ka supply. And route in common peroneal nerve supply, mostly you can see extensor tibialis anterior and one more branch to basically one given is a peroneus tertius. This peroneus tertius, basically this is known as a common peroneal nerve supplying muscles. Next, talking about actions and sensory supply. So for that, what you need to know is basically this. This is the tibial nerve, as we discussed. This tibial nerve, as we have seen all these muscles. What are these muscles? Known as posterior muscles. Posterior muscles are what? Those are flexors. So plantar flexors. All the tibial nerve supplies the plantar flexors. Just a tibialis posterior being the inverter. Okay, and sural nerve, we can see one more communicating nerve is the sural nerve, and this is the sural nerve, as we can see over here in this diagram. This is the communicating nerve, this is known as a sural nerve. I'll write also, this is a sural nerve. And then we have this SPN, which is known as common peroneal nerve, SPM. What is SPM? Superficial peroneal nerve. It supplies what? It supplies all the everters. So these two, whatever these peroneus longus and peroneus brevis, both of them are everters. And these muscles, all the anterior compartment wala, those are dorsiflexors or extensors. Posterior compartment muscles are plantar flexors, anterior compartment muscles are dorsiflexors, and the tibialis anterior muscle being the so more about muscular actions I can tell is that see, all the posterior compartment muscle, all of them are the dorsiflexors. No, sorry, these are the plantar flexors. Sorry for that. Anterior compartment muscles are all the dorsiflexors. In the posterior compartment, there is a muscle known as tibialis posterior. That muscle is known as basically the inverter muscle. And there is anterior compartment, there is a muscle called the tibialis anterior. That muscle is called the everter muscle. Okay, and these two muscles, that is peroneus longus and peroneus brevis, these two muscles are basically what we call as the what do we call them, they are basically called as the everters. They will call eversion of the foot, therefore they are called as everters. Talking about sensory supply, so in sensory supply, for example, that's the foot 1 2 3 4. Okay, and sorry guys, my drawing is very bad. I don't know मैंने first anatomy ऐसे गंदे diagrams draw करके how did I pass, but still I passed. So yes, this is the sole of foot. Okay, and to understand the sensory supply we need to draw this like this, and then this much, and then this much. So what's there is, this is known as the lateral plantar nerve, correct? Lateral plantar nerve will supply what all structures? So lateral plantar nerve is going to supply, as we saw over here, what all structures? The abductor digiti minimi, then the flexor digitorum, this accessorius, and what we have is second, third and fourth lumbricals, then adductor hallucis, flexor digiti minimi brevis, and all the introsci. So that's thing, and it will supply this blue color part. So this much, as you can see I have done this. This is basically supplied by what? This is supplied by the lateral plantar nerve. Lateral plantar nerve. This is supplied by what? The sural nerve. What is the sural nerve? It's a communicating branch between the common peroneal nerve and tibial nerve, correct? So this is a common peroneal nerve and tibial nerve. It's a communicating branch between the two. Therefore the sural nerve supplies this part, this much. This is supplied by as I told, the lateral plantar nerve. Sole of foot is supplied by calcaneal branch of the tibial nerve. What is it? Calcaneal branch of tibial nerve. And this yellow part, okay, this part is supplied by the suspence nerve, which is again a branch of basically the femoral nerve. And this part is supplied by the medial plantar nerve. What is supplied by? Medial plantar nerve. Now talking about the dorsum of foot, as you can see in this diagram, in dorsum of foot, this is supplied by dorsal plantar nerve. This is supplied deep peroneal nerve, and superficial deep and deep peroneal nerve. What is the deep peroneal nerve? This much part, nail beds, that's known as the deep peroneal supply. Okay, then superficial peroneal nerve, as you can see over here, entire skin supply. This is of course supplied by sural communicating nerve, no doubt, and this is supplied by and this yellow part is supplied basically by superficial ये अपना SPN. So this is how the difference is done. Sural nerve, SPN, yellow suspence nerve. This is also supplied by suspence nerve. Then this is the superficial peroneal nerve, deep peroneal nerve, and the sural communicating nerve. Now let's quickly discuss about the injuries. For example, if the sciatic nerve is injured in the gluteal region, what will happen? Most important, if it is injured in the gluteal region, the effect will be basically complete supply of the leg will be basically hampered. Why? Because there is a dislocation of hip joint occurs. In ortho you mostly see hip displacement surgery, dislocation surgery. Why surgery is such a big thing for the treatment? Because it is so important to surgery it, because surgically rectify it, I'm sorry for the before error, triangle, then complete supply of leg can be hampered. So hip dislocation surgery is important. Then hip joint displacement. Then basically incorrect injection technique, we give the thecal in this what is called as intramuscular in the gluteus region. Next is piriformis syndrome, that is piriform syndrome. Why? Because just below above the piriformis lies the greater sciatic notch, and from there the sciatic nerve arises. So piriformis syndrome can basically lead to the sciatic nerve compression by the piriform muscle. Next is the tibial nerve. If tibial nerve gets arrested, it can basically because of plantar flexus we can see, or we can say because of plantar flexus, or because tibial nerve what it supplies the posterior compartment, right? So tibialis posterior, muscles of the sole of foot we can see, or skin of the sole of foot. Anywhere there is a injury is caused, or muscles of sole of foot or tibialis posterior, what it will cause? If there's a plantar flexors are the cause of injury, there will be basically loss of plantar flexion, that is basically it will cause what? Dorsiflexion. Then tibialis posterior, what is its cause? What is action? Inversion, weakness of inversion. Muscles of the sole of foot, paralysis of sole, and slight flat foot. This flat foot is also called as a pes planus. And then what we have is a skin of the sole of foot, anesthesia of the sole of foot. So tell me, if tibial nerve gets arrested, what part will be anesthetized? See these diagrams and tell. Correct. This tibial nerve was getting divided into lateral plantar and medial plantar. So these two parts will get anesthetized. Next. CPN, common peroneal nerve, that is fractured neck of fibula, superficial peroneal nerve, loss of eversion, correct? And because superficial peroneal nerve was giving supply to peroneus longus and peroneus brevis, which were the everters, and since it will be fractured, these nerve will be damaged, loss of eversion action, it will cause inversion, and loss of dorsiflexion will also occur, because will lead to the basically foot drop, and this foot drop will basically is responsible for the damage to the superficial peroneal nerve. And we can say this dorsiflexion or extension, foot drop, equinovarus will be the condition which is caused. This is a very important clinical aspect, equinovarus. Next is superficial peroneal plus deep peroneal, both of them are damaged, high steppage gait, sensory loss of the dorsum of the foot, and only deep peroneal nerve is damaged, sensory loss of the first web space. Can you see? This is the first web space, deep peroneal nerve supplying it. So if it is damaged, only sensory loss of the first web space, but over here high steppage gait will occur because this sensory loss of the first web space, at the same time the superficial peroneal nerve entire, so high steppage gait will occur. Flat foot will occur most prominently, where flat foot will occur most prominently in the paralysis of the muscles of the sole of foot in case of tibial nerve damage. So yes guys, that was the most important nerve of the foot, that is sciatic nerve, foot, leg and thigh it supplies. Though it originates from the gluteal region, there is no role in innervation of any muscle of the gluteal region. Okay, so guys, as discussed, sciatic nerve topic is completed fast, and now I'll continue with our very interesting topic, which is a silent patient. So what happened, basically I read it, and I found it quite interesting. I'll tell you the crux of the story now, that is at the end of this video. So what happens in silent patient is that a lady is there. Okay, I'll not take the names because there are many Latin and English terms over there, but here, being us as an audience, it will be much more interesting if I take some layman terms as the names. So for example, X, Y and Z, let name the lady as X, let name the husband of the lady as Y, and let's name the detective involved in the story as Z. So basically the X, that is the lady, is so happy in a marriage, but eventually she realizes that her husband is cheating on her, and she basically feels entrapped, and slowly she starts losing trust on her husband. One day what happens is, Z, the masked man or the detective, both of them being the same person, he enters her house and वो basically lady को बांध के रखता है to a chair. He ties her to a chair and he kidnaps her. Rather kidnaps, he just like holds her. So he just holds her like a captive. And eventually her husband enters the house, and the masked man gives the husband two options, that either free your wife immediately by calling the police, or just let her die by from my hands. And after giving this option to the husband, it was so what obvious that the husband must choose to call the police. But the husband was numb, and he didn't react for a few seconds, and his such numb reaction made the wife like temper out. She fumed out of anger. She was so devastated emotionally that how can he think upon such a thing, that it was so but obvious that of course that it was need to call the police. How he can think of letting her die by the hands of the masked man and not calling the police? So she was super shocked, and the whatever crumbles of trust were remaining for him, everything waved off like a jiffy. And what happened was, the maskman then left the place, freeing the woman. Just basically what was it, that basically the maskman wanted to reveal the motto of her husband to the wife. So basically that happened. So once freed, she stood up. Ex-woman stood up and she shot her husband 5 times on his head by the bullet given by the masked man. And she basically, after that, what happened, she realized she shot her husband and completed her revenge, but that was out of a complete emotional devastation given by the husband, and by the shock that husband would rather prefer to kill her than calling the police. And that was a super shock for her, and that complete loss of trust led to the complete destruction of their whatever bond was crumbled, and whatever bond was basically remaining, that got completely ended up and by the end of her husband. And after that she chose to completely be silent, not saying anything again that and this. She became a silent patient, and a murder mystery was now discovered by the media. The police came, they tried to investigate the lady, but lady remained silent throughout the process. People thought that she's somewhere mentally disabled, that's why she's not talking and this and that. So a psychotherapist was assigned to her, and the psychotherapist then tried, and he realized that she is not talking, but she is basically, she can draw, she can write. So he made her draw through paintings, he made her write through articles and this and that, and through this and that way. However, somehow he tried to made her speak. Like, he did not speak by her mouth, but she spoke through the paintings and through the articles written by her, and basically they become the evidence. And the major twist and plot in her story was that the masked man was none other than the psychotherapist who was basically handling her and treating her. That was the major twist. Then the story goes to the flashback, that what happened actually was that the masked man's wife, or the basically psychotherapist, both of them being the same person, that the night of the murder, the masked man which came and burgled into her house was none other than the psychotherapist. That even though realizing that the psychotherapist who was treating her, that the ex-woman still chose to remain silent and not revealing to anyone that the psychotherapist which is treating me is actually the masked man who triggered me to murder my husband. So basically the masked man just made her the pawn. He made her the pawn, the mohra banaya usko, and complete his motive. Then comes the main twist, that why did the masked man make her the motive, made her the main mohra? So what was the motive of him behind it? So it was revealed in the story that the masked man ka wife, masked man psychotherapist being the same person, so the masked man का wife and the ex person वो जो साइलेंट पेशेंट बन गई है, उसका हस्बैंड जिसको मार दिया गया बाय द साइलेंट पेशेंट ओनली, दैट इज़ द वुमेन ओनली, both of them were having a affair, both of them were doing a infidelity. sorry for the mispronunciation. So yes, both were having the affair and infidelity. Therefore, this infidelity lead to a murder. That murder was actually to be seen to be planned by the masked man only, the psychotherapist only, but eventually total blame went on this silent patient, and the silent patient realized the masked man is just trying to trap her and make her more emotionally distort. So at the end what she decided is to speak out the truth, and she spoke through her mouth the truth entirely, which led to the arrest of the masked man Aka, that is also known as the psychotherapist. But later what happened was that it was soon the arrest of the masked man, the women, that is the ex-women, the silent patient who finally spoke up. It was the last few moments she spoke up, because eventually fell down on the ground, and the police discovered that she was poisoned. So basically it was who poisoned her at the end of moment of her, it was of course the masked man Aka, so known as a psychotherapist, and who was treating her. So basically this is so twisted and storyline, that how a patient is used and whatever, not patient is used, but basically this is a very emotionally traumatizing triggering story, and it's a very nice book. And what I explained you now was basically the crux of it in my language, because this was the most simplified manner I could have explained it to you. So guys, I think that was very interesting part of the video. Thank you so much, stay connected, and I'll make more videos like it, don't worry.